So it's 5 o'clock, so we can begin. So I'm going to read our procedures for the remote meeting. In keeping with an act relative to extending certain COVID-19 measures adopted during the state of emergency, as amended by Governor Baker on February 12, 2022, this meeting will be conducted remotely over Zoom. Attendance by the board members will be remote, and remote attendance shall count towards quorum. The meeting will be broadcast live and recorded on ECAT. To use Zoom, you'll need to use the link on the agenda or download the Zoom application at www.zoom.us and create an account or use one of the call-in numbers listed on the agenda. You will need the webinar ID to join by phone only. While conducting meetings remotely, we will endeavor to keep meeting operations as close to our standard procedures as possible. However, use of this platform will necessitate some additional meeting protocols. While the board members or commissioners and applicants will be on video and audio, the public participants will join the webinar as an attendee, meaning they are muted and with no video feed from them. During the public testimony portion of the meeting, members of the public can be recognized by using the raise hand function found under participants from Zoom, or make a request with the Q&A function. If you are joining only by phone, you can press *9 to raise your hand. If an applicant wishes to display materials, please make the request of the chair and the email materials to board staff for sharing on screen. When starting testimony, please state your name and address for the record. There is a markup function in Zoom which will allow you to call out specific areas of your presentation materials. As in any public meeting, indecent behavior will not be tolerated. Anyone who abuses use of the meeting platform will be terminated from the meeting. Business will be handled at all times indicated on the agenda. Business not concluded in the allotted time will be tabled to the end of the meeting to allow for timely logins and remote attendance. Board members are asked to announce themselves when making a motion and second, so that it will be clear to the audience and minute takers who made motions. All votes will be by roll call. And then lastly, when all business indicated on the agenda has been completed, the members will vote to adjourn meeting, signaling the end of the meeting and the termination of the ECAT recordings. All participants will be disconnected from the webinar at this time. So, excuse me. Sorry, guys. So the first thing on the agenda today is, well, I'll make a motion to start the agenda, the Board of Health meeting, Monday, April 11th at 5 p.m. Everybody's in attendance. The first thing on the agenda is a review of the meeting format. Is that you, Kristen?
No, that's what you just did.
So, so that's what we're just going to do. There is no new meeting format. Okay. And then the next thing is the novel coronavirus update.
So just a couple of things that I wanted to make sure the board was aware of. We are continuing to see cases. We actually are, for the past 3 weeks, have seen a climb from early March. In early March, we were seeing just about 10 cases a week. And then towards the end of March and into last week, so for the past 3 weeks or so, we are seeing 30 to 35 cases a week. This is kind of noteworthy in that these are people that are actually going to the doctor or a clinic or some format to get their positive test result. This doesn't count all the people that are just doing it at home and then doing the right thing. These are people that are actually seeking medical interactions to get their positive test results. We today posted some additional information on the town social media pages, just to make sure that people are aware that many of the home test kits may be coming up on, or may have already come up on, a point where they are labeled as being expired. This is something that people want to check before they throw them away. When these test kits first were released, they were given a very conservative window of being effective. But what time is showing is they are effective and usable much longer than had originally been projected. So the FDA has been granting each individual manufacturer extensions depending on the data that they submit, showing that the reagents, that the test itself is working for another 3 months. We're typically seeing 3 and 6 month jumps. At some point they'll stop and say, okay, that's it. That test kit doesn't work beyond this date. So we just want to caution people not to just throw them away, that they can go to each individual manufacturer's website and check out to see if there's been a extension on the expiration date. We also, I know, have all noted recently that there is a new recommendation or authorization for a second booster shot for those of us that are over 50, as well as adults with compromised immune systems. We are working with our fire partners through our community paramedicine program and hope that by the end of this month, we will be standing up what we're going to kind of call micro clinics, either 10 or 20 slots at a time, just to gauge what the actual need is in the community. We're not getting a ton of phone calls. When the decision was first released, the office did get some phone calls. So we're going to see how much of a need there is. Also get that information over to Stonehill so that if they have students who are in need of boosters, we hopefully can continue to provide that service, but it definitely will be on a smaller scale because we're just not seeing the demand from the community. That is all I had for COVID updates. Did anybody have any questions?
Do you know if they're still checking to see which variant it is, or do they not do that anymore?
I believe they're doing the serology on them, but we don't see them immediately. It's not, it doesn't pop up right away. It does take a little bit longer, and even looking for it in Maven, we kind of have to dig a little bit deeper. But it does seem like what's the majority of cases right now from what I'm hearing, are either the Omicron or the BA2. We'll have Department of Public Health, those normal, I know they're throughout this, I've told you guys on Mondays, well, we have a call tomorrow. They've scaled those back to every other week. So next, we will have one tomorrow. It'll be the first one we've had in a couple of weeks. So we should get some updated information on that call, I would assume.
Okay, thank you. Does anybody else have anything on COVID they want to ask or say? Okay, so the next is the arbovirus, tick-borne and mosquito-borne illnesses.
Okay, so in your packet, you have the notice that we received from Bristol County Mosquito Control Project, detailing their plans to, in mid-May, continue with an application that they've been using for the past couple of years that's targeted directly at breeding grounds and preventing the mosquitoes from even hatching. So they're looking towards early to mid-May. It would be a helicopter treatment. It is Mark, do you want to go ahead? You are very good at explaining how this product works.
There we go. Sorry, I was trying to unmute myself. Yeah, what it is it gets into the wet areas and actually gets up and under the root structure, and it creates like a biofilm. So the larvicide can't come up and breathe, and it pretty much suffocates them, so they can't promulgate and become a full-grown mosquito. So that's pretty much how it works. From what I read from the literature, it's going to be one application for the area. It's the area north of if you look at your map, to give you where the mini golf range and the batting cages are. It's right north of that is where they're looking to go. So.
And it's just that area of town, correct? It's not the whole
Yes.
town, it's just that little section, correct?
Right, it's a
Correct.
targeted application to the actual core of our breeding ground.
Great, thank you.
And Priscilla, in speaking with her, said they had a very good success rate with it last year. So that they wanted to make sure they got it again this year. So.
Okay. Anything else?
I would like to add that I've been contacted from the school to go in physically for the first time in a few years to do the tick and mosquito presentation for the kids, looking in the beginning of June, probably 2 mornings, and do it in the cafeteria with like 4 classrooms at a time. So that will be happening. I'm working with someone over at the Olmsted Richardson School on that right now.
Great, thank you.
Going into this summer, we would also, an idea that Mark and I have discussed in the past would be to make this curriculum piece or this little presentation available to our camps as well in town. So that'll be one of the projects. Hopefully Mark will, now that we're able to be in person again, hopefully we can get a relationship going with some of those types of programs and get the information out to them as well. We are talking to a potential intern for the summer, and one of the topics, one of the charges that we would be asking her to help us with would be creating some very good social media pieces, website pieces that are just really basic. We did it last year. We had a couple, but my abilities to actually create content are kind of limited. But we'd like to be able to get more reminders up on the web page and get more clarification up to the public about the differences between the ground spraying that Bristol County Mosquito Control does, the aerial spraying that the state can authorize, and what people can do in their home, in their own yards and homes to help limit their exposure to the different arborviruses.
Okay. Next, we have a vote to allow staff to waive the temporary food permit fee for licensed vendors working with local nonprofits.
So additionally, in your packet, you have an explanation of this item. Tim, did you want to explain to them what you're seeing happening?
Sure. So currently we've had a couple of nonprofits, the booster clubs, Stonehill College. They've been wanting to host food truck events. Stonehill College, since COVID happened, they've been having this company called Food Fleet, is like kind of a go-between all the food truck vendors, and they would organize and bring food trucks over to Stonehill as a nice amenity to the students to get them outside. They can use their meal card at each of these food vendors and just pay for their food that way. And then some of the booster organizations have been looking to partner with some food trucks to have them come to, you know, some of the events like OA Track has like a big track meet coming up. Easton Youth Lacrosse had a big event last week, and they had a food truck there as well. And so I'm looking at it, it'd be like a win-win-win for everybody here. In the past, food trucks, they are, according to the law, food trucks are permitted in the town or city where they're based out of. So for us here in Easton, we have a couple of food trucks that are based here and work in and out of restaurants. So they have a base of operation. They can do all their warewashing inside the restaurant. They can get fresh water and get rid of their wastewater as well. So we permit, you know, a couple of them, and each city and town, wherever they're based out of, they permit them. But when they come to a different city or town, they're supposed to notify the health department that they're coming. And a lot of times they would pull a temporary food permit for the one day or the couple of day event that they're coming to. And a lot of times they are for nonprofits. So we would ask, or the nonprofit in the past would ask the board to waive the fee. But since we only meet monthly, a lot of times the events are come up, like they ask a week in advance or 2 weeks in advance. And obviously they can't make the Board of Health meeting. So we're trying to see if the board is willing to allow the staff, myself, to waive the fees for these nonprofit organizations. If they have an annual permit, all the nonprofits, their food permits are waived anyway per state law. So like the churches, the temple, the NRT, those are some examples of ones that have an annual food permit that we waive the fee for anyway. So it also, by allowing the food trucks to do the work, it's done in a more safe manner. I don't have to worry about, the boosters, they turn over, you get new parents each year. They want to use for instance, the snack shack up at OA, and they want to grill burgers all day. Then you have to have a person who has a ServSafe certificate on staff or on site to oversee the operation, making sure that everything is done correctly, proper temperatures are being handled, sanitation. By having the food trucks, they already have that. And that's part of the requirement to operate. So we know that they know how to handle food in a safe manner. So sometimes that's a financial arrangement where they might get a percentage of the sales for the boosters. And also the boosters, they wouldn't seek any waste. They wouldn't have to set up anything. It would just be as simply as having the food truck come to the event, produce food for them, and that, the boosters don't have to get involved with that piece.
So from our perspective, the biggest win on this really is the food safety. When you've got a professional organization with the right equipment, and we wish we had thought in anticipation of this to take some pictures of some of these vehicles, because they are legitimately restaurants on wheels. And when we compare that to, as Tim said, parents and boosters buying product at BJ's, transporting it, trying to cook it on a grill, trying to hold it, not having the education, not having all the proper tools. It's stressful for us because we're taking the time to educate them. We're, making sure that they have all of the pieces of equipment. But if the truck comes in and it's already been inspected and we've already seen it at other events, there's a much higher confidence in the food safety piece of it. We'd almost be encouraging food safety by making this choice, as opposed to the boosters. If they're not able to do this, or if the food vendor says to them, I have to pay $150 for the permit, you're going to have to pay for that up front. We would prefer they come to us early, they use professional groups, and we feel like this policy or permission would create a much safer environment and a much more transparent. I mean, we're not chasing them then. They're not trying to not get the permit. They can come in and be very transparent, and we can ensure that all of these functions are happening safely.
Can I ask Kristen, I recently was trying to get a food truck for something at my son's college, and they told me they did have to pull a permit in the town.
We would still have them pull the permit. We would still
Okay.
have the checks and the balances where they would come in and pull the permit, so that we do have a record. We're just looking, if the nonprofit is pulling the permit themselves, the parents doing it on a grill at the back of a truck, there's no charge, because state statute says we can't charge a nonprofit. What we'd like to do is, by extension, if they're using the food truck, grant them the courtesy of that free permit, but it would just be the fee that was waived, not the process.
Okay, and this is, okay, go ahead.
Oh, sorry, totally interrupted you.
No, so a resident that was going to get a food truck, they'd still have to pay for it. This is just for those working with like the fundraisers and those kind of nonprofits.
We would be using nonprofits. If they wanted to petition the Board of Health and ask for the fee to be waived, they could do that. If if the mobile truck vendor wanted to get an annual permit in town from us, they would pay one fee and they'd be able to go in town anywhere they want over the course of the year. A lot of times they're, testing the waters, or they're just coming in to do one event. And the cost of this temporary permit can often be cumbersome and have, the reverse impact on the nonprofit that's trying to just use food as a fundraiser.
Harry, I'm sorry, what were you gonna say?
No, are food trucks licensed by DPH or by the towns?
Tim?
Yeah, so each city or town based where they're based out of permit license them and inspects their truck. So we have one here in town. You know, I've seen the truck, went through the truck with them, and then their base of operation is also a restaurant here in town.
Excellent.
Anything else? Questions or anything? Anything that,
I have one. As far as waiving the fees for boosters and everything like that, absolutely. They're so cut short as far as fundraising as it is. Are we waiving fees for Stonehill as well?
Stonehill is a nonprofit.
Okay.
State statute says we can't charge the nonprofit directly. And what we're trying to do is encourage them to use professionals by affording them the same statutory protection of not having to pay for the permit.
Mm-hmm.
But having their subcontractor pay for it, basically.
okay. Anything else? Any questions or comments or any hands raised in our little question and answer spot? Let's see, nope.
No.
Does anybody wanna make a motion on this?
Yeah, I will make a motion to allow staff to waive the temporary food permit fee for licensed vendors working with local nonprofits.
Second.
All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. Okay, and then we have betterment applications. We have 4 of them. Do we want to do them all together? Or are there any that we need to address separately, guys?
No, I'll just go over a quick review. I mean, obviously they're all in failure. So on the agenda, it lists 23 Linden Street. They're looking for 45,000. 15 Scarlet Court is looking for 26,000. 96 Kevin's Way, 45,000, and 93 Chestnut Street, 20,000. So, but they're all in failure. They're all in good standing with the town as far as the taxes and bills. And some of them already have their septic design done and some don't, but they're all looking for the loan.
Tim,
Yes.
how old is Scarlet Court that they're in failure already?
It's about 20 years. So they are just going to
that
go
old?
to the reserve field. They're going to keep the existing tank and just replace the D-box and go to the reserve.
Add a couple figures or whatever. Yeah.
Yeah, the reserves were in between the fingers, so that's what they're going
Right.
to. Yep.
Okay.
Anybody want to make a motion?
Sorry, yeah.
Make a-
I will make, oh,
Oh.
go ahead,
Oh.
Chris, you can go.
Go ahead.
I'll make a motion to approve the betterment applications for 23 Linden Street, 15 Scarlet Court, 96 Kevin's Way, and 93 Chestnut Street.
Second.
All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. Then we have the acceptance of the minutes from March 14th. I'd like to make a motion to accept the minutes from March 14th.
Second.
All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. And then the last items are staff or member notes.
So, yep, I just wanted to use this opportunity to highlight one of a very successful program that we've been able to roll out with our community paramedicine partners with Children's Hospital Injury Prevention Department. Within the past month have hosted 2 car seat safety classes. They have involved a 45-minute to an hour presentation, question and answer, and all participants are then given a brand new car seat from Children's Hospital. And we've been fortunate enough to have our our own firefighters who have been trained in car seat installation on site as well to do the installation of these car seats. So we had a weekday one was the first thing that children allowed us. It filled up almost instantly. We then were able to add a Saturday and now have one additional class in July on our calendar. We'll put registration materials out when we get closer to that date. And working with them, Captain Vamosi has also set up a program that will be coming, that they'll be coming out shortly. We'll be getting more information up on the social media and the website to do kind of a bike helmet program. Same type of thing. Participants will walk away with a properly fitted bike helmet. So just some really positive, things that are happening in the community that are a result of our, cooperative endeavor with the community paramedicine project. We also have we will be going to see the cabinet for the school department at the end of this month. Captain Vamosi will be giving out, relaying information, dealing with 3 of the programs that we had rolled out initially. That program that deals with medically compromised children and pre-registering them, the information on car seats, as well as the information on our SHARPS program and the fact that we now have a kiosk. Just making sure that we put the information at all junctures where people may benefit from having that information, by having the adjustment counselors, by having the nurses in the school buildings know about these additional programs. We feel it's going to be a win-win. The other person that'll be joining us at that meeting is our new benefits navigator. Her name is Tracy Levine. She joined us last month. Tracy's sole purpose is to help residents navigate to resources. So again, wanting to have, those that might have contact with some of our families or some of our residents that are experiencing challenges, wanting them to know that we do have a dedicated person on our staff that these families can be sent to that will help navigate housing insecurities, food insecurities. Her job is to find programs that are out there and help our residents get resources that they may need. So we're kind of excited about getting, that opportunity to get that information out into the community as well. And that's what I had for my staff notes. Mark or Tim, do you have anything?
I don't.
I do not either.
Any board members have anything?
Do not.
Nope. Okay. So I'd like to make a motion to adjourn the meeting April 11th at 5:28 p.m.
Second,
All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. Thanks, everybody. Have a good week.
Have a good night.
Bye.
Thank you.